Welcome back once again to Neil Oliver Live. Now, my monologue addressed the subject of excess deaths and the products marketed around the world as vaccines. No one is closer to the fire of all that than my next guest, consultant cardiologist Aseem Malhotra. Aseem lost his dad recently and has written about how he believes the jabs his dad took likely contributed to his death. For saying so and for calling on the suspension of the rollout of those products, Aseem has put himself squarely in the crosshairs of those determined to keep pushing the needle. Thanks for being here, Aseem. How do we explain these crazy times?
Yeah, I think crazy is probably the best way to describe it. But we can actually, explain it in a very rational way, Neil. So let's just talk about the evolution of my thinking and understanding and analysis of the whole vaccine issue. So I've said this before, but I think it's important to go over it again. So I was one of the first to have 2 doses of Pfizer vaccine. I was on Good Morning Britain helping to tackle vaccine hesitancy amongst ethnic minority groups in February 2021 because I convinced a friend of mine, a film director called Gurinder Cheddar, to have the vaccine. And my thinking at the time, so it's very important to understand this because I think where I was then is where many people still are now, okay? As a doctor, vaccines are kind of the holy grail in medicine. There's a big problem generally with over-medicated population. I've been a big campaigner exposing that and working with the British Medical Journal and even, the Medical Royal Colleges, where I work with them as well, to launch a campaign in 2015 called Too Much Medicine, because, just to give you some headline figures, and we'll come on to the vaccine in a minute, it's estimated, by one of the most credible researchers in the world, Peter Gosha, that prescribed medications are the 3rd most common cause of death after heart disease and cancer, because of side effects. And when one looks at the root causes of that, a lot of it is because the clinical information that doctors get when they're making decisions for patients comes from drug industry-sponsored trials, invested interests, where, because they are profit-making machines, they exaggerate the benefits and safety of their drugs. However, even though I've been one of the biggest critics in trying to highlight these issues and solutions for it, I never could conceive of the possibility that a vaccine could do harm. Because in the medical world and for many people, if there was addiction, if you put, safe and effective is almost synonymous with vaccines, despite all of that. So and I was on Good Morning Britain, and I said, listen, I understand there are rational concerns for vaccine hesitancy. Look at the history of what pharma have done. But despite that, compared to all the other drugs we give out to people, vaccines are the safest.
But they had to change. The definition of vaccine was altered to get these products under the wire, which is why I refuse to call them vaccines, because I don't think they are that at all.
Yeah, that's a controversy. No, I know.
So they came in under the cover of the safety and efficacy that was the heritage of traditional vaccination.
I'm a cardiologist, right? And I would never. And I've had so many vaccines, and that's part of my job, and it's to protect patients. And we talk about vaccines. If you look at, for example, the chickenpox vaccine, you vaccinate, 100 kids, 95 of them will not get the infection. We were sold on this idea at the very beginning through press releases and from Pfizer, et cetera, that there was 95% effectiveness of the vaccine. And actually, ultimately, when we go back and look at that data properly, we find, and this is something that's been published in peer-reviewed journals now, that the absolute benefit from the very beginning from those trials, if we trust them completely, was about 0.84%. It was what we call a 95% less likely in the randomized control trials to get infection. But that meant you ultimately had to vaccinate 119 people to prevent one getting infected with the original Wuhan strain. So at that time, we obviously didn't know how things were going to evolve at the beginning. My thinking, and I kind of knew that, was, OK, you've got something that prevents infection in 1 in 119, but I didn't expect there to be any harm. And if you think about giving millions of people that vaccine, you are ultimately it wasn't going to prevent transmission directly, ultimately it didn't, but indirectly, as you prevent one infection in 119, ultimately you will reduce transmission without any concerns of any harms, right? And if you think about that going back, Neil, if that still was the case, fine, it wouldn't have been as effective as we thought it would have been, but it wouldn't have caused harm and probably would have done some good. So let's just start from where we are there. Then things evolved, and, for me, the first thing that happened was my dad suffered a sudden cardiac arrest at home in July 2021. Very fit man, 73-year-old. In his community, everyone thought of him as one of the fittest guys. I was shocked. I knew his cardiac history inside out. I knew his lifestyle. I am a cardiologist, even prior to all of this, that has a reputation and expertise in understanding exactly how heart disease develops, the lifestyle factors. And his post-mortem findings didn't make sense. He had very severe coronary artery disease, which is odd because scans a few years earlier hadn't, explained, were fine. So I thought, hold on, he's had rapid progression of heart disease. I don't get this. What's happened here? Is it stress? I don't know. A few months later, the Times contacted me in October 2021. This is really interesting. And they said to me, the journalist said to me, she said, Dr. Malhotra, you're an expert in this area. We've got these unexplained increases of heart attacks in Scotland. I think she said something like 25% increase. What do you think is causing it? Now, at that point, I said, I'd predicted to some degree that lockdowns and the effects of lockdowns would have an effect further on. I almost predicted because we know historically, Neil, where there's been huge psychological stress on populations from wars, even for years after the wars ended, there are increased heart attacks and strokes. Okay, there's a slight increase. And I said to the Times journalist, I said, actually, to be honest, we know people's diets unfortunately got worse during lockdown. People are severely stressed. And I would expect those to be the reasons. Now, interestingly, the journalist asked me at the time, what about the vaccines, Dr. Malhotra? And I said, listen, I think it's highly unlikely.
Still at that point,
still at that point, I said, as a good scientist, it would be very naive of me to completely discount any possibility here because we're not sure exactly what's happening. But I said it's very unlikely. And she quoted me in the article. There's a big Times. The headline was poor diet and stress linked to increased heart attacks, according to leading cardiologists, right? That was my opinion at the time. But information changes, Neil. And, this is several months on from my dad's death. So, I was in dinner. A few people, people at the time I thought were trolls on Twitter said vaccine, vaccine, when my dad suffered cardiac arrest. I was actually angry at the time. I thought, what is this nonsense? How is that even possible? I blocked people who were suggesting it was a vaccine. So I just want to understand the emotion here, because I think the emotion I had then can explain some of the emotion people have now. Then the information changed, and then several bits of data came, and I won't go bore you with all the details, but I'll get to the crux of it in a minute, which suggested that the mRNA vaccines accelerate heart disease, they cause myocarditis. And then I started looking at the data, and I looked at what was going on nationally. We had an increase in cardiac arrest significantly 2021 versus 2020. What data was being published but not publicized in credible journals by credible scientists who are not linked to the industry. I've been involved in this space for such a long time. I was the first guy in this country to highlight the harms of excess sugar. When I came out saying sugar was a problem, I got attacked from everybody, saying this guy's a nut, I won't name these organizations, so-called credible organizations, no, sugar's fine, all that kind of stuff. And it took time, and I published in medical journals, and eventually things changed. So I've been here before, Neil. When I looked at the data on the vaccine, and this is where we are now, and we're talking about excess deaths, we have the most overwhelming evidence you can have to talk about the link between the vaccine, mRNA vaccines, and cardiac problems, right? So what bits of data do we have? You mentioned the randomized control trial data. A reanalysis of the highest quality level of data. So you've got lots of different studies. Some have higher impact and more importance and credibility than others. And at the top of that impact factor in terms of the credibility of study is the randomized control trial. Double-blinded randomized control trial. Pfizer and Moderna's own trials, reanalyzed by independent, very credible researchers, published in the journal Vaccine, but it should have been headline news, let's be honest with you. I'll be honest with you, it should have been, it wasn't, right? But I found it, and it was peer-reviewed in the journal Vaccine, and they found from the reanalysis the risk of serious adverse events, hospitalization, disability, life-changing event in the original trials that was approved by the regulator showed you were more likely to get a serious adverse event from the vaccine than to be hospitalized with COVID, which you mentioned already. That's a smoking gun on its own. Okay, but let's not just rely on that data. You talk about replication. The lead researcher in that trial, research, Joseph Freeman, he actually recently came out, as you know, about a week ago and said, listen, I did this study. This is what I found. We've now got conclusive evidence linking the vaccine and sudden cardiac death because very recently, autopsy studies published in a peer-reviewed journal found that a significant number of people who died within a month of having the vaccine, who suffered sudden cardiac death through autopsies, through special staining techniques, they were able to clearly say the vaccine, mRNA vaccine, was caused. So that's irrefutable. Now, the question is, what's the rate of that now? How common is it? And that original randomized control trial data is a smoking gun. It's actually at least 1 in 800 at 2 months. So am I saying that all of the excess deaths that we're seeing in terms of coronary artery disease, 30,000, according to the British Heart Foundation, who also said it's no longer to do with COVID, right? The College of Emergency Medicine said maybe 3,000 to 5,000 because of ambulance delays. So it's got a huge 20-odd thousand so-called unexplained. Now, of course, some of it's going to be stress, some of it's going to be lockdown, but these are speculative to some degree and likely. But the only information we have that's clear from randomized control trial data evidence, pharmacovigilance data, autopsy data, high-quality observational studies, you know, let me just give you an example here. When I published analyses on sugar and its relation to harms to the heart, which ultimately got accepted and led to changes in policy, I met Jeremy Hunt. I was invited to 10 Downing Street twice because of my work on obesity and on sugar. The analyses that I did linking sugar and its harm to the body is inferior, Neil, to the analysis that we have on the link of the COVID mRNA vaccines and cardiac risk. Think about that.
Yes.
Right? So how do we explain the craziness? Well, let's just go back. Let's look at the root cause of the issue. Prior to the COVID pandemic, population health in this country has been pretty dire for a long time. We've had stalling in life expectancy since 2010. We have more and more people living with chronic disease. So what does that mean? Overall, our healthcare system, with all the different components, is causing a regression in the population health in this country for the last 10 years. Regression. We're going backwards. What are the root causes? They're multifactorial. But two of the big root causes are, you know, this is probably a topic for another time, is ultra-processed food and unhealthy...
We should to wrap up because we're going to run out of time. So,
OK, fine,
yeah.
fine. So what I would say is we are dealing with the root cause of this problem. There's a corporate capture of public health. We have these very powerful entities that are there to make profit, and I'm talking about big pharma here, that exert influence over politicians, over the knowledge environment, over the mainstream media, over medical journals, over the regulator that gets most of its funding, which I didn't know initially. The chair of the BMA didn't know this in a conversation I had with him. 86% of the funding of the regulator in this country comes from pharma. People are well-intentioned. There are huge conflicts of interest. There's willful blindness. People are burying their heads in the sand. This vaccine, very clearly, from the evidence that I've analysed, needs to be suspended or paused until this is fully investigated.
Dr. Aseem Malhotra, your testimony is so persuasive, and do please keep doing what you're doing. You often seem like a lone voice, but I know you're not because I'm plugged into so many other people who are saying similar, but keep doing what you're doing, and please come back soon and update us on this campaign.
Thank you, Neil.
Thank you so much. After the break,